Alright, let's talk about cervical cancer. It's a big word for something that affects the cervix, which is like the entrance to the womb. It's a serious illness, but the good news is it's treatable, especially when caught early. Cervical cancer happens when cells in the cervix grow out of control. These abnormal cells can invade nearby tissues and, if not treated, spread to other parts of the body. It's important to remember that having these changes doesn't automatically mean you have cancer. Regular checkups are crucial because they can detect these changes early on when treatment is most effective. Now, what causes these abnormal cells to develop in the first place? Well, the main culprit is a virus called HPV, short for human papillomavirus. HPV is a really common virus, passed on through skin-to-skin contact during sex. There are loads of different types of HPV, and thankfully, most are harmless and go away on their own. However, some high-risk types of HPV can cause changes in the cells of the cervix, which over time might develop into cancer. Don't panic. Having HPV doesn't mean you'll definitely get cervical cancer. It's actually very common, and most of the time, our bodies fight it off. Now, while HPV is the main cause, certain things can increase your risk of developing cervical cancer. Smoking is a big one. Smoking weakens your immune system, making it harder for your body to fight off HPV infection. Having a weakened immune system from other conditions, like HIV, can also increase your risk. Early age at first sexual intercourse and having multiple sexual partners can also play a role. It's important to remember that these are just risk factors. Having them doesn't mean you'll definitely develop cervical cancer, but it's important to be aware of them and discuss any concerns with your doctor. Section 4. Recognizing the signs. Early stages of cervical cancer often don't have obvious symptoms. That's why those regular smear tests are so important, even if you feel perfectly fine. However, as the cancer progresses, you might notice unusual vaginal bleeding, like bleeding between periods, after sex, or after menopause. You might also experience unusual vaginal discharge, pelvic pain, or pain during sex. It's important to remember that these symptoms can be caused by other conditions too. But if you notice anything unusual, it's always best to get it checked out by your doctor, just to be safe. Section 5. Treatment options, fighting back. If cervical cancer is diagnosed, the treatment options will depend on things like the stage of the cancer, your overall health, and your preferences. Surgery, radiotherapy, and chemotherapy are all possible treatment options. Surgery might involve removing the cancerous cells, part of the cervix, or in some cases, the entire uterus. Radiotherapy uses high-energy rays to destroy cancer cells, while chemotherapy uses drugs to kill or stop the cancer cells from growing. The good news is that treatment for cervical cancer is often very successful, especially when it's caught early. Section 6. Staying healthy. Prevention and early detection. So, how can we protect ourselves? Well, prevention is key, and it starts with the HPV vaccine. This vaccine protects against the types of HPV that cause most cervical cancers. It's usually given to girls and boys before they become sexually active, but it's never too late to talk to your doctor about getting vaccinated. And of course, regular smear tests are an absolute must. These tests can detect abnormal cells early on, even before they turn into cancer. Remember, early detection is crucial. By being proactive about our health, we can significantly reduce the impact of cervical cancer. Stay informed, stay healthy, and don't hesitate to reach out to your doctor if you have any concerns.